Hey there, welcome to NP Crash Course. I'm glad you're here. Now, this channel is all about making nurse practitioner topics easier to understand without the fluff. Now, whether you're in school, studying for boards, or already practicing and just need a quick refresh, you are in the right place. Now, this is actually my very first video, so thank you for watching. If you like this kind of breakdown, which is quick, clear, and clinical, just hit that like button and consider subscribing. Now let's dive into today's topic, hypertension. Here is my disclaimer. Now, what is hypertension? Well, hypertension is a chronic elevation of arterial blood pressure. It is categorized into primary or essential hypertension, and that makes up to around 90 to 95% of cases. And secondary hypertension, which results from another condition like renal artery stenosis or hyperaldosteronism. The core mechanism often involves increased systemic vascular resistance or cardiac output. Now, clinically, it's one of the most powerful modifiable risk factors for heart disease, stroke, kidney failure, and death. Now, let's take a look at the blood pressure classification. Now, according to the AHA, normal is less than 120/80, and elevated is systolic 120 to 129, and diastolic is under 80. Now, stage 1 hypertension is going to be from 130 to 139 systolic and 80 to 89 diastolic. Now, stage 2 is where it's going to be higher than 140 systolic and higher than 90 diastolic. Now, you're going to be using these ranges to determine the diagnosis as well as how you're going to treat the patient. Now, how do you diagnose hypertension on a patient? Now, to confirm hypertension, you need at least 2 elevated readings on 2 or more separated visits. Now, make sure to take 2 or 3 readings per visit with the patient seated, rested, and using both arms initially. Now, if you believe that the patient might have white coat syndrome, then you can have the patient stand up, which is ambulatory, or have the patient do home blood pressure monitoring. Now let's take a look at the physical exam and labs. Now your physical exam should include a fundoscopy, heart and lung auscultation, and checking for vascular bruits. Now remember, if the patient has an S4, that is a sign of hypertension. Now labs include a CBC, CMP, lipid panel, TSH, UA, and HA1C. Now, depending on risk factors, you may also order an EKG, an echocardiogram, or a urine albumin to creatinine ratio. Now, with lifestyle modifications. Now, before jumping into meds, you gotta emphasize the lifestyle. This is the most important thing. Don't focus on the pharmacological treatment first. Try to focus on the lifestyle modifications. Now, do the DASH diet, which is low sodium, rich in fruits and veggies, physical activity, aerobic and anaerobic exercise, so more than 150 minutes per week, moderate aerobic, and weight loss. Now, try to have the patient cut 1 kilogram because that could actually lower the blood pressure by about 1 millimeter of mercury. And last but not least, limit alcohol, quit smoking, and manage stress. I cannot tell you how important these 3 are. If the patient is able to not cut it off completely, don't have the patient do cold turkey, but at least titrate it down, it can make such huge improvements into the blood pressure. Now, for the pharmacologic management. So pharmacologic treatment is more of like a stage and risk based. If the patient has stage 1 hypertension and a 10-year ASCVD risk over 10%, you start the meds along with lifestyle. For stage 2, start 2 meds from different classes. You can use thiazide diuretics, ACE inhibitors or ARBs, and calcium channel blockers as a first line. Now, African American patients respond well to thiazides and calcium channel blockers. However, for patients with chronic kidney disease, ACE inhibitors or ARBs are indicated because it can provide renal protection. Now, for follow-up and monitoring, you're going to have to recheck the blood pressure in 1 month if the meds are initiated or adjusted. So the goal for most patients is going to be under 130 or under 130 over 80. Now you have to assess the side effects and adherence, and don't forget to reinforce lifestyle changes at each visit. And so for the ICD-10 and EM coding tips, I realize that not a lot of YouTubers don't really go over the ICD-10 or the EM coding tips, so I kind of just want to touch on it a little bit in case some people have some difficulty trying to figure out, oh, what EM code should I use? So for documentation, just use the ICD-10 code I10 for primary hypertension. Now, if you're screening at Z13.6 and for chronic medications, you can use Z79.899. For billing, use the EM code 99213 for low complexity visits or 99214 for moderate complexity with additional decision making. Now let's go over some clinical pearls and some referral criteria. Now here are the clinical pearls. Always confirm the blood pressure readings before diagnosing. Think secondary causes in younger patients or those with resistant hypertension. And refer to cardiology for hypertensive urgency, emergency, or resistant cases. Now, if you're going to be in an urgent care setting and the blood pressure is just extremely elevated, then you would have the patient be transferred to an ER. So if your urgent care isn't next to an ER, then you have to contact 911. But if your urgent care is right next to an ER, then you can give report to the doctor in the ER, then have a nurse transfer the patient from the urgent care to the ER. Let's see here. And so monitor renal function closely when prescribing ACE or ARBs, and never combine an ACE inhibitor with an ARB. Now a quick recap. So, to recap, confirm blood pressure with multiple readings. Classify based on the AHA 2023 guidelines. Start with lifestyle changes, then meds based on stage and risk. Use first-line agents smartly, and code correctly and refer when necessary. And thank you for watching. So subscribe to the Nurse Practitioner Crash Course for more clinical breakdowns. Make sure to like, comment, turn on notifications, and subscribe. And follow along as we simplify NP level medicine one condition at a time. This is the very first video I've ever created and uploaded onto YouTube. So if you guys have any tips or anything I should improve on, just let me know. Okay? Well, thank you so much. Have a good day.